Hello, everybody. I'm just admitting you. If any of you have videos on, I'll turn them off for you, or you can automatically turn your video off as well. And I'd like to start by reassuring everyone that your names are not seen by the other attendees. But if you are seeing other attendee names, you can leave me a comment straight away in the bottom of the box. And I'm just slowly starting this presentation whilst I get everybody joining. So I just want to make sure that everybody's available. You can turn your videos off. Excellent. Excellent. So apologies for the slow start. I just wanted to make sure that I had everybody who was going to attend and join us. I'd like to start by saying thank you for joining us this afternoon. You can see Maria Brennan-Thorns, her videos at the top.
Hello.
Hi, Maria. Maria's going to stay muted, and then I'll introduce her in a bit. So let me just share my screen so I can open it up to the presentation. Great. Okay, so thank you again for joining us for our Coolsculpting virtual event this afternoon. I appreciate your time. I'm Angela Hunt. I'm the nurse business manager for Qutis Clinics, and I've been working within Qutis Clinics for over 11 years now. I lead our Coolsculpting treatment. To date, we've delivered over 900 Coolsculpting cycles, and that's across hundreds of different patients, all with very satisfied results. Maria Brennan-Thorns, who you can see in the video image, is our clinical director and our nurse business owner as well. Excuse me 1 minute, I'm just going to admit a couple other attendees. I appreciate your patience with this. Excellent. Thank you. So the agenda for today. So a little bit about Qutis Clinics to start with. We have 3 clinics. We have one in Tame, which is our flagship clinic. We have one in North Oxfordshire in a town called Witney. And we have a clinic in Pickett's End, which is just outside Hemel Hempstead. We've been established for over 30 years now, and we offer a range of different treatments. However, today's focus isn't on Qutis Clinics even, it's on Coolsculpting. The agenda for the day is not too long. I won't take up too much of your time, and I'm going to try and be very succinct with what we're talking about. But it's about Coolsculpting. What is Coolsculpting? How Coolsculpting works, where Coolsculptings come from, and how safe it is. Maria, I'll introduce Maria later on, and she'll focus on why Qutis Clinics introduced Coolsculpting to our business model over all the other competitors, why we chose Coolsculpting, and focusing specifically around the safety features. I have a video testimonial from a patient, so you don't have to listen to me talk the entire time. That testimonial video is actually linked to a YouTube video, so it will be marginally clunky. So I apologize for that, but I'll link it and then I'll link it back. And then I have a load of before and after images of patients we've treated, which is what everybody wants to see. I'll answer the most commonly asked questions. And then at the end, again, that's only going to be about 20 minutes. At the end, I'll open up the platform. Again, it's confidential, so you're not seeing each other's questions, but I'll read the questions out loud to answer any questions you have. All right? I'm just going to admit one more person. And to all of those late joiners, I just want to say hello and thank you for joining us. I've just done a brief introduction about myself, nurse business manager, and Maria Brennan-Thorns, who's our clinical director and clinic owner. I'm going to go straight into the presentation now because I appreciate your time, and it's coming up to sort of mid-afternoon and lunchtime as well. So, introduction to Coolsculpting. And, just let me admit one more person. There we go. Great. Okay, so my introduction to Coolsculpting. what is Coolsculpting, first of all? So Coolsculpting is a controlled way, a controlled technology of cooling and permanently killing fat cells in a target area. It's literally that simple. But of course, the technology and the sort of science behind it is a bit more complex. But in essence, that's what it is. I'm taking fat cells, subcutaneous fat cells in an area, cooling it to a certain degree and killing those fat cells permanently. The areas that we can treat, so I'll start from the top of the body, and this is a really nice image. We can treat under the chin. We can treat the backs of the arms. I can treat the entire back area where you get fat, and that's typically bra area, middle of the waist, and the flanks area. I can treat the abdomen, so the entire abdominal area. On men, I can treat the breast area. On women, I can treat the bra puff area. Lower down, we treat the inner thigh, the outer thigh, the banana roll, which is that bit just underneath your bum, and I can treat above the knee area. All right. Some commonly asked questions about areas to treat that I cannot treat, and this might help some of you out straight away. I can't treat the facial area. I wouldn't want to take any fat away from the facial area whatsoever, so we're very cautious of that. I obviously would never treat a female breast area, and again, we're very cautious of that. I wouldn't treat the front of the thigh and the back of the thigh. So I would treat just under the bum area, but sort of circumferential thigh area, we can't treat. It's really difficult, and I can explain a little bit more as we go through the presentation. And I don't treat the calf area either. This is because it would deform you, because I'm taking pockets of tissue and I'm permanently removing fat areas. So it's not like a blanket that you wrap around the leg. Unfortunately, we'd all love that, to kill all those fat cells. It's sort of pockets that sort of like my hand that we put against the thigh or the abdominal area. And doing that on the thigh would be very difficult without deforming. So we can treat inner thigh pockets and outer thigh pockets, but I can't treat circumferential. All right. How Coolsculpting works. This is the really interesting bit. And this is a really nice visual image of how Coolsculpting works. So like I said, I take, first of all, Maria, you can be my example. Can you see this okay, the slides? Thank you. I take a target area of subcutaneous fat, and this is important. I'm only treating subcutaneous fat. So I'm not treating adipose fat, which is the fat that sits around your internal organs. Coolsculpting doesn't go that deep into the body, nor am I treating the skin or the muscle around the subcutaneous fat. I'm only treating the fat, and that's the amazing technology that is Coolsculpting. We just focus on those fat cells. I treat them at a certain temperature, so I bring them down to minus 11 degrees, and they stay like that for a certain duration of time. On average, it's 35 minutes. During that time, cellular death occurs. Because I freeze that fat cell, it bursts, basically, and as you can see in the images. And over the course of weeks and months, that fat cell is then removed from the body through the lymphatic system. Ultimately, I'm looking to reduce, on average, 27% of those fat cells in the target area that I'm treating, all right? How it works permanently is we develop all of our fat cells, our subcutaneous fat cells, believe it or not, in our adolescent years. So from the age of being born to the age of 18, you develop your fat cells. From the age of 18, you stop developing fat cells. What happens is the existing fat cells expand with diet and exercise, or I should say shrink with diet and exercise, and expand with the lack of. And it's why in those that have struggled with childhood obesity or just their weight as children struggle more in adult life with diet and exercise, because they have more fat cells. Does that make sense to everybody? If it doesn't, just ping me a question in the comments box and I'll address it afterwards, okay? So what happens to your fat cells after treatment? And this is kind of linked to how your body responds to it as well. That fat cell during treatment is crystallized, so it's frozen, and then it bursts. It doesn't go away straight away. It takes about 12 weeks on average, but it starts to sort of leave the system within 2 to 3 weeks post-treatment. Now, this is a negative thing in a sense of patience, because we want to have treatment, walk away and see results straight away. But it's a positive thing in terms of our body. It means because cellular death and then the disposal of those fat cells is so slow, it has clinically to date, no adverse effects on your liver, your kidneys, your lymphatic system, or any other body function. It's simply drained away through the lymph system, and you just pass it. You don't notice it when you go to the toilet, either passing urine or feces. You don't notice it. You don't suddenly have an odd bowel movement and think, oh, I think that's where my fat's gone. It's not like that. It's literally like any other toxins coming and going through your body. It's a very organic process. And like I said, you start to see results from 4 weeks. So treatment happens, you'll be swollen, you'll be a bit sore, but you can carry on as normal. But it's very subjective as to how patients feel post-treatment. But regardless of that, you can carry on as normal with your day-to-day activities, and then you start to see results at 4 weeks, but optimum results are at 12 weeks post-treatment. And one other thing, before I introduce Maria to discuss the Coolsculpting difference, I should have said this at the very beginning and I knew I'd forget something. What makes Coolsculpting unique and, in my opinion, superior is it's non-invasive completely. So back to the beginning of what is Coolsculpting. Coolsculpting is not surgery. Coolsculpting is not needles, nor is Coolsculpting a course. It's not something you come and have every week, every month. It's typically a one-off treatment or maybe 2 treatments spaced 6 to 8 weeks apart. It depends on the treatment journey and what my patient and I are looking to achieve. All right. Now, I'd like to introduce Maria at this point, and Maria is going to talk about the Coolsculpting difference. So why Qutis clinics chose Coolsculpting amongst our competitors, and what makes Coolsculpting superior in terms of its safety features amongst our competitors. Thank you, Maria.
Hello, everyone, and welcome as well. So as Angela said, my name is Maria Brennan-Thorns, although I'm on Angela's account at the moment, but I'm the nurse who started Qutis clinics 25 years ago. And to be in a clinical business for that long and to be the clinical lead, I'm sure you'll all understand it's important for me to be able to sleep at night, that I've chosen the safest and the most science-backed and the most efficacious, something that really works, piece of equipment that I can. Now, having been a healthcare professional and been in commerce for a number of years, I do know that there are certain standards that we can look to which help us who are buying these machines. We can look to these standards to make sure that they have passed scrutiny. Now, this is American technology, and let me reassure you that the American market is one of the most litigious and scrupulous market for anything that is a food or a drug that's being brought into that market. And that standard is called the FDA, the Food and Drug Administration. Now, it's not law over here. However, we in the UK, we look towards this standard authority to give us reassurance that this works and it's been scrutinized. So we're in these times that we live in, we're more aware of science and science-backed claims than ever. So I decided that I would go for this technology, and I had been looking at it for 10 years before we purchased. So I've had it myself. It really works. It's very exciting, and it doesn't really hurt at all. It's a very easy technology. And for those of us who are more Europhiles, it also has the European CE mark. And does that about cover it, Angela? Do you need to ask me anything else that I could share that I might have forgotten?
Well, how about safety-wise? So can you recall, and if you can't, I'm putting you on the spot now, but what makes Coolsculpting superior, aside from our safety features such as FDA and CE marked? Why is Coolsculpting superior to our competitors, which would be
Well,
things like CryoSure and stuff?
yes. Now, um, because we have been delivering these treatments for a good 2 years or so now, I have seen some cryo, that's freeze burning injuries, etc. Because within this machine, it has alarms and cutoff points that allows the technology to constantly sense the temperature of the skin and the fat cells. Now, people make their way to established clinics like ours, sometimes with previous histories. And as nurses, we always want to help. And of course, we see these things. So I had to be sure, I'll just connect it with the fact that I had to be sure that I was buying something that had these safety features in them. And sometimes I've been on the machine myself as a patient when a thermal event occurs. And this probably is going to be a bridge into you talking about that. But the machine alarms and the nurse, and we're all, that we deliver these treatments with this supervised via nurses. Is able to come and see what happens, and basically the machine is then the cycle could be stopped, etc. Now, we have seen some injuries to the skin from other technologies, cheaper technologies, sometimes maybe not even operated by healthcare professionals. And I, as clinic owner and the person forking out many, many thousands of pounds for this, did not want that on my conscience. I need to be able to sleep at night.
Yeah, I mean, and I should probably highlight when Maria says a thermal event, that so the machine will pick up the detection of tissue that is about to become too cold or not cold enough, meaning the treatment's not working, and stop before an event occurs. It's phenomenal technology, and we've never had consequently any adverse events from it, which makes it superior. And additionally to that, Coolsculpting is solely focusing on freezing and killing fat cells. It's not doing anything else, meaning it's not obviously a physical liposuction, but it's not focusing on fat cells. It's not focusing on skin tightening. It's just focusing on reducing the amount of fat cells in the area. Although consequently, for quite a few years, Coolsculpting said that it didn't have an impact, or they couldn't make a claim that Coolsculpting had an impact on either skin tightening or cellulite appearance, just the reduction of fat cells. So basically the size of an area. But of late being the last couple of years, we've seen multiple cases, and multiple being hundreds of thousands of cases, where the appearance of cellulite and the appearance of tighter skin has consequently occurred post Coolsculpting. And I myself have been witness to that with my own patients. And you'll see a bit of this in my before and after photos as well. Thank you, Maria, for that.
Can I
So,
say one more thing, Ange?
yeah,
In the name, there's a clue there, sculpting.
yeah,
I have seen poor results from other machines because it's just not only about the machine, but about the quality of the healthcare professional that delivers this.
yeah.
And changing one's shape is possible. Many of us at my age, and you can guess what my age is, it's older than Angela's, we get back fat and midriff fat, and it does make us feel old. And I can't tell you how much better I feel in clothes since decreasing that amount of fat. And it makes me feel younger as well. So I think that's something as an individual I can help. I'm finished now.
Feedback. Thank you. Thank you, Maria. But that's good patient feedback. So moving on to your personalized Coolsculpting treatment plan and what will happen post this event. So following this event, I will have your contact details and I will individually get in touch with you to arrange. Typically, if I'm honest, I would love a face-to-face consultation because I like to see my patients' figures, feel the tissue that you want to have treated, and it gives me a really good idea of what kind of treatment plan we need to put together and how much it's going to cost you, and how much time I need to allocate for your treatment plan. But given the current situation, I think that I can comfortably get away with virtually consulting my patients, which means no time out of your day except for 20 to 30 minutes in front of a screen, one-to-one, you and I, where we discuss your treatment needs, your sort of goals that you're aiming to get to. I can set expectation. I can put together a treatment plan, give you cost, and that cost will include the open event discount. So you joining today, I'll know that you're part of that discount package, so that will include the discount price. And then we can book a treatment from there. Appointment availability, again, it's very odd times at the moment, but appointment availability will be discussed on a one-to-one basis, depending on my patient's needs, goals. So a lot of my patients last year, we were getting ready for weddings, or I did a few mothers of the brides, all sorts of things. I had a 65-year-old patient actually who was getting married. So there's no age in relation to having a wedding coming up. However, because the year was so bizarre, some of my treatment plans got pushed later to the year, but we can discuss that in our one-to-one events, all right? My next slide is a patient testimonial, and this is one of our patients who's come to us, and she is going to discuss her experience candidly about how she found Coolsculpting. But this is the clunky link I mentioned where I have to put you onto YouTube, so I just appreciate your patience for 1 minute, and I'm also just admitting one more person. So for those late starters, I'll say hello and welcome. We've gone through science of Coolsculpting, and I'm now just about to introduce a patient testimonial. I should also say at this point, this is being recorded and will be rerun through our YouTube channel and Eventbrite until Saturday, this Saturday coming up. So anybody who's missed the beginning, if you're interested, it's been short. We've only been going for about 22 minutes. You can go back and watch. And if you watch the recorded version, you can fast forward me if I'm talking too much. All right, so I'm just going to introduce Kathy's slide now. Bear with me one moment.
I felt that even with diet and exercise, there were certain areas that just weren't shifting and became sort of a bit of a bête noire on my back. So I felt that Coolsculpting would be a good treatment. I think I liked the lack of downtime. I chose a reputable clinic, and I like the fact that it's painless. Absolutely fine. Everything was covered, very thorough consultation. I learned a lot that I didn't know before. All my questions were answered. I was completely happy. I was very, very well cared for. Everything was explained in great detail. Everything was explained prior to whatever was going to happen. I knew exactly what was going to happen during the day. So it was great. It was very thorough indeed. It wasn't painful at all. It was just a little bit cold, obviously, because of having the gel on and the applicator heads. It just felt like a little bit of a suction cup. There was no pain. There was really no discomfort at all. Yes, absolutely. Because Qutis has a reputation, it's a nurse-led clinic, and the therapists are very experienced and, you know, under the umbrella of a medical aesthetic clinic. There really wasn't any recovery time. I felt a little bit numb in the area afterwards, and I was warned about that. And that did go on for a number of weeks. I can't say it was uncomfortable or I was inconvenienced by it. So there wasn't a recovery time. It was perhaps a little bit sore that evening, but yeah, mild discomfort. No, I suppose my only question was there a risk of a tissue damage with freezing it? And that was dispelled to me very quickly, so no concerns at all. I feel that it's given me increased confidence because I always felt that I had this bulge on the top of my bra. I had to have quite a broad bra because I'm big busted, and I've always felt uncomfortable. I haven't wanted anyone to touch me on my back, always been a bit self-conscious. So that's really flattened it out nicely, and I'm expected to see results ongoing. Yes, I would absolutely recommend Qutis clinics.
Excellent. Bear with me one moment whilst I just make this big again. Okay, thank you for your patience with that, a little bit clunky. So I promise she paid for treatment, and I didn't pay her to say any of those things. I would like to address one thing. That patient mentioned that she thought it was painless. That was her experience. Now, pain is a very subjective thing, and have any of my patients said it was painful? Yes, some have said it was painful, but not painful to the point that they couldn't stand it. Painful to the point that they felt it a little bit. You don't feel it so much during treatment, but I do a massage post-treatment for 2 minutes, and that increases results nearly up to 70%. But more importantly, it's to take those, well, that's the most important fact, actually, increases results up to 70%, but it's to take the crystallized fat cells and encourage circulation back to that frozen area to burst the fat cells, to kill them. Now, probably 80% of my patients hardly notice it, but I do get a small percentage that say, oh, it was uncomfortable, and they were really tender and sore for a few days afterwards. But it's such a subjective thing that it's always precarious when I prepare my patients for it, because if you don't experience pain, my patients think they're not going to have such a great result. And if it's really painful, sometimes they think something's wrong. Neither. It's totally down to the individual and how you experience pain and how it feels. However, I will say nobody has ever had it so uncomfortable that they didn't come back for more treatment if needed, or go on to have another treatment area. But some people can feel it a little bit more than others, but pain is probably a word I would avoid, but nor could I say it was painless. And that's just being totally honest and preparing you, because everybody, that's one of my commonly asked questions. Now, I'm going to go into before and after photos, and then quickly talk about, once again, the duration of results. So how quickly you see results from having treatment. This photo actually isn't Kathy, but it's a patient that had a similar treatment to Kathy, the patient that just spoke. I'm allowed to say her name. And it's because we haven't got to quite her final results yet. But this patient had a very similar treatment, and this was 12 weeks post her final treatment plan, and she was ecstatic. So when you see results, again, I've already said you start to see results from 4 weeks post-treatment, but optimum results are seen at 12 weeks post-treatment. However, as Coolsculpting's advanced over the years, over 60% of patients continue to see results at 6 months post-treatment. And the results journey is something really interesting to discuss, because a lot of patients, and one of the commonly asked questions is, I'm on a diet, or I'm on a new lifestyle plan. Am I better off waiting until I've lost a bit of weight to have Coolsculpting, or should I just start it straight away? And my answer is start it straight away. And the reason is I'm permanently killing fat cells in a target area. Those fat cells won't come back, but what it does do is makes diet and exercise that much more achievable, and you feel like you're getting somewhere. So your goals are so much closer because you've kind of had a head start already. I'm going to concentrate on 27% of fat cells in a target area, regardless of where you're at with your diet and exercise. So when you start exercising or dieting, you'll see results so much quicker because you're working with less fat cells. All of that being said, you do not have to diet or exercise to see results. What I do ask is you carry on as you are at the moment. So don't suddenly start binge eating and stop exercising if that's what you do already. Just carry on as you are at the moment. You won't necessarily see a change on the scales post Coolsculpting, but you will see a change in inches around waist or arm or back area. Going into more post-treatment results. So this is 8 weeks post-treatment. On the left-hand side is the pre-treatment and on the right is post. This was actually, so 8 weeks after she had a treatment session on her abdomen. And this is a really good example of what I was talking about earlier with skin tightening. Now, I've not done any skin tightening on this patient. She's in her late 50s. And she'd always struggled. She was quite a petite woman and always struggled with her abdominal area. And multiple factors include things like estrogen levels, so HRT management, all have an impact on how we can control our abdominal area in women. So Coolsculpting helped significantly for her, but she'd just come back from a 2-week all-inclusive holiday and was convinced that she'd put on weight, even though she said she could feel her trousers felt looser. And we were shocked. She was shocked to see her after results. And she went on to have another treatment session because her goal was to get flat and toned around her abdominal area. But this is a good example of what you could expect 8 weeks post your first treatment session with me. This is the submental, so the chin area. Again, I'm not taking any fat from the face. I'm only taking that stubborn fat under here. My considerations when I treat this area are things like, is it fatty tissue? So I ask qualifying questions like, have you had it all your life? Does it expand or shrink with diet and exercise? Because if it does, that's a positive indicator that you have fatty tissue there. If it doesn't, and you've had it since you were born and it doesn't shift ever, it could be more indicative of anatomy, that it's not necessarily fat, it's more you. This is inner thigh area. This patient had 1 treatment session, inner thighs, and this is 12 weeks post. Again, the left-hand side photo is the before photo and the right is the after. And what you're looking at is the significant difference in gap between thighs. If you can't see that both photos, you can move the camera image and just move it around your screen so you can see both images. This patient had both abdominal area and flank and upper back area treated. And you can see in the contour of her waist and in the front area of her waist. She's in her early 60s. Again, the same sort of presenting challenges that my earlier patient had, which is she's always struggled to just shift this weight. She eats quite clean, but she's a working woman and she works a lot. So she struggled with trying to get in the gym and shift it, but even then it wasn't going. And this was her beginning of her 2nd treatment session. She had 2 treatment sessions with me. She was with me all day, but her results were absolutely phenomenal. And she lost inches and went down a dress size on her waist. She was really pleased, as am I. This is one of my other patients. So this is a common patient I see. So this patient's in her early 40s, and this is her post-baby belly, and she couldn't get rid of it. Planned to not have any more kids, but just wanted to shift that. And she had 1 treatment session with me, and this was 12 weeks post that 1 treatment session. And the aim was flattening the tummy and tightening it. And as you can see, we've succeeded. And this is just through Coolsculpting. This is an outer thigh area. I typically treat my outer thighs twice. However, I wait my full 12 weeks until I retreat the outer thigh. To be blunt, it's a stubborn area, but everybody responds differently. And those that respond, I've never seen a non-responder on outer thighs, but when they respond, they hyper respond. So you really see a difference. This was post 1 treatment, and this was 8 weeks post her first treatment. And this patient is just over 8 stones. So she's she's probably about 5'6", so about 165 centimeters. Quite a slight woman, but she'd always struggled with that area and could never shift it. Again, this is an outer thigh patient, and this is 12 weeks post her first treatment session. This is a young girl. My previous patient was in her mid-30s. This patient is in her late 20s and just couldn't shift the area, but she came in for her after photos 12 weeks later in shorts because she was so pleased with her results even before seeing the before and after photos. Arms, so this is underarm area. Again, this patient, so she's in her early to mid 40s, always struggled with her underarm, backs of arm area. When I treat backs of arms, one of my considerations, kind of like the chin area, it's not so much that if it's fat, but the more mature, so the older the patient is, the more I'm conscious of skin laxity. So what Coolsculpting won't do is if you just have a load of loose skin under your arm, it's not going to tighten that up. So for those of you that are watching wondering, am I suitable? But if you can pinch fat and you've got a good bit of skin elasticity, meaning you pinch your skin and it doesn't sag on you, then you'd definitely be suitable for underarm area. This is another patient. This is actually me, and this was the backs of my arms, and I've always struggled with it, and I'm quite fit, but just could never shift it, and it's genetic. And I was really, really pleased, and this is 12 weeks post my treatment results. Abdominal area. So this was actually a young mum. She had 2 children. She's in her mid-30s, but she worked full time, and stress, if I'm really honest, was her biggest culprit, where she wasn't a yo-yo dieter, but she felt like her weight yo-yoed. So we Coolsculpted her to just tighten up her midriff. And even now with stress, diet, exercise changes, she still tells me she's got a tight abdominal area and she's ecstatic with it. This is a male chest. This patient is in his 50s. He had 1 treatment session with me, and this was 12 weeks post the first treatment session. And again, a relatively fit man, but he worked full time. And as life is, we just struggle to commit to everything when lifestyle and family gets in the way. So this patient had his chest treated and was absolutely ecstatic with it. And we noticed inches difference when we measured. This is a submental patient, so under the chin area. No matter how much she lost weight or gained weight, if she gained weight, she would gain it here. But if she lost it, this would be the last place to go on her. So it was the first place we Coolsculpted. And as you can see from the photos, she was ecstatic with the results, as I was. And she went on to have 2 other areas treated. And I tell my patients this during consultation: careful, because it's addictive. Because once you see the results, you then start thinking, oh, maybe I'll just have this area treated. And another angle to just see her results. And as you can tell from the alignment of the ear and the nose, I've not done any camera trickery here where I'm sort of getting her to extend her neck out. It's the same position, but it's made her jawline look longer because we've basically contoured it. Sometimes what I do with my patients, often, we then actually will go post Coolsculpting and use dermal filler to further define and contour the jaw area. Maria's running an event in 2 weeks' time where we'll talk about just that. This is when I open the platform up to questions. So I'm going to come out of my presentation screen because then I can just see any questions that you're going to send to me. But I can see quite a few at the bottom here. I'm going to read them out and then I'll answer them. And if any of them, Maria and I might take turns answering questions because I'm getting sick of my voice. One patient's just told me something. Okay. Okay, 2 patients have mentioned that you can see other candidates' names, and I'm going to have to apologize for that because I can't think of a way that I can unshow your names. Most people don't have a surname present, which is a good thing, but I can't think of an incognito way to get rid of that, so I pre-apologize for that. I think next meeting we set up, I would have to try and have that incognito, which is what we thought we had that set up. I'm sorry for that. Treatment question. How long will I be numb for? What is your favorite area to treat? If I need a second treatment, how much time in between treatments? And do I need to do anything in preparation for the treatment? Okay, so first question, how long would you be numb for? Again, it's one of those subjective things, but I prepare my patients to say, on average, it's about 2 weeks. And when we say numb, it's so the backs of my arms, I was numb for about 6 weeks, and I could run my finger down and not quite feel it. It felt weird, but I carried on exercising. I was back at the gym the next day. It's just literally numb to touch, but it goes off. Some patients report it lasting for a week. Some patients, like myself, say 6 weeks. So it's very subjective again. What is my favorite area to treat? All of them, honestly, all of them. It's more about the results and how that impacts my patients psychologically. My most common area to treat would be the abdominal area. I treat a lot of abdominal areas. If I need a second treatment, how much time in between treatments? This depends on our treatment plan and my patient. On average, I'd say anywhere from, so no sooner than 4 weeks, but typically 4 to 8 weeks is the average. And it's because you have to wait 12 weeks to see results. So you don't want to wait a full 12 weeks till you have your next treatment session. But again, it depends on the area we're treating. Maria.
Could that mean that if I wanted the front of my abdomen and the back of my abdomen, but I was only able to give sufficient time, let's say for so many hours in week 1, could I come back the following week and have my back done, different area?
Yes, absolutely. So thank you. That is the only, that would be the only, yeah, if I'm treating a different area, I could do it the next day. It's the same area that we would have a gap between treatments. Absolutely. Good point. Do I need to do anything in preparation for the treatment? The answer is no, nothing, literally absolutely nothing. The only thing I would ask is to avoid on the day of treatment and 2 weeks after treatment, any anti-inflammatory medication. So that would include a non-steroidal anti-inflammatory, commonly known as ibuprofen, or Nurofen, and also antihistamines. It's because I want inflammation in the area, because with that inflammation, what's happening is your white blood cells, along with a load of other things, are killing the fat cells. And that's what the inflammatory process is doing. It's killing those dead fat cells to take them away. So I don't want to dampen that with medications. But I give my patients a little booklet and pamphlet, a little sort of gift bag to take away post-treatment, and all of that's written down for you. And we also send an email upon booking your first treatment with a guideline as to what you need to do and need to bring with you. And it's things like cozy socks, because you're sat on a bed for anywhere from 2 to 4 to 6 hours. And as you're sat still, some people struggle with cold feet. So just cozy socks, something to read, that kind of thing. Maria?
Well, just to add about numbers of treatment, when I first went to Coolsculpting, the organisation, as a customer, because I bought the machine, one of the female executives came in, and normally, you know, sometimes people might say, hello, I'm Maria and I'm a nurse, or hello, I'm Maria and I'm the VP of marketing. But she came in and she said, hello, let's say she was called Angela. She wasn't, hello, I'm Angela and I've had 30 cycles. And it really made us sort of have a little bit of a giggle and a bit of like, oh, thank God, because that means that if I want to spend that on myself, I can. And don't tell anybody, but I'm not sure how many cycles I've had, but I enjoyed it so much, the feeling that I get from being more sculpted, that I've had quite a few cycles. And it's up to me how I spend my money, and it makes me happy. It's great.
Yeah. Well, that brings me on to my next question, actually. One of the questions here is, and it's a commonly asked question, how much does it cost? Now, I'm not being aloof, I'm being really honest. It's a very hard thing to tell somebody without consulting them how much it's going to cost. But to give you an idea, if we're looking at it under the chin submental area, which is a small area, so think like this, The larger the area, the more treatment you'll need in terms of within one treatment session. So the more expensive it will be. But to treat this area in isolation, on average, is £1,600. So it's only £1,600. With our open event price, it would be only £1,400. And what I was doing last year with a lot of my patients is, in the absence of being able to book to go away on a holiday, we just focused on getting our bodies ready for the holiday that we could hopefully book to go on this year. And this is the point when I always say it's permanent. So Coolsculpting isn't astronomically expensive, but again, I'm going to overuse this word today, subjectivity. What is expensive to one person is different for another, but it's the value within the treatment. It's permanent. It's not surgical, which means the risks are significantly less, and it's permanent. And it's not a course. You don't keep coming back to see me. You have the treatment and you see the results. But in terms of your cost, I'm speaking to the audience, I need to consult you one-to-one to confirm that. But following this, probably on Monday, I will get in touch with you individually to book in virtual consultations. Obviously, no cost implication for that. And then we can discuss cost when I ascertain your treatment needs. How many areas can you have treated on one day? Well, multiple. So it depends again on what we're doing. But to give you an example, you can have an entire day of my time. We pre-book this, we pre-plan it. But let's do a hypothetical of a patient I recently treated. We treated her submental area, so we treated under her chin, and then I treated her stomach. And that was one day. And then she came back the following week and we treated her flank area. Another patient I treated, not last week, I can't say that, before Christmas, I treated this patient. It was her tummy area and it was her flank area. But it depends how much I'm doing. So each cycle is 35 minutes, and it depends how many I need to cover an area. But multiple is the answer to the question. So will the area be swollen afterwards? Yes, you will. Yeah, you will have swelling. Not swelling like a goiter, but you will have inflammation and it will be sore. Maria, what are you going to say?
I'd like to point out that obviously, as nurse and as recipient of Coolsculpting, it really is about, it feels thicker than it looks.
Yeah.
And we have a little bit of that when we do facial injections, that things feel humongously swollen, and they're not, because as you know, we have two different types of nervous systems, and the feeling part of the nervous system can send a message back to you that makes it feel thick. You may notice a little bit, but you can't notice a lot, I would say. It's not something that you'd be embarrassed about.
No. Some of my patients that when I treat upper back area will report to me that they wore a comfortable sports bra for a week after treatment, where their fashionable bras just felt a bit restricting. But it's more because they're not really swollen, but they're just a bit tender in that area. So that's the sort of thing you can expect. What happens if I put on weight after I have Coolsculpting? Good question. It's a really good question and one of the most commonly asked. So I've permanently killed fat cells in a target area. If you put on weight after Coolsculpting, first of all, you have to put on a significant amount of weight to notice an increase in that target area that I've treated. Significant amount of weight would be sort of 6, 7, 8 stones up. I saw a patient post-treatment, so she had her tummy and her flanks treated with me. And I saw her 12 weeks later and she put on 8 kilos, which shocked her, and she couldn't believe that she had, because we weigh you at the beginning of the treatment session and then at the end, and we could still see a visible difference in her treatment results before and after. You don't suddenly put on weight in a brand new area, but what happens is your existing fat cells in other target areas store the weight, but you maintain your results in that area. Maria?
I think it's nice to give a bit of an anecdotal example. We have had people who've had gone on to get pregnant after their Coolsculpting. Who knows if it's planned or not, but what happens is that we've seen them because they are clients, patients at Qutis clinics for other things as well. And to echo exactly what you just said, they've still got that sculpting appearance. So, you know, these things are quite interesting to people because we've actually, within our 2 years of doing these treatments, we've seen many, many different cases of this type of thing.
Yeah, exactly that. Oh, sorry, I've missed one question. What about the veins, nerves, etc., that are incorporated in the lipase to be frozen? So it's purely focusing on fat cells. So the nerves that sit, they are sitting quite literally. You've got a clump of fat cells and you've got nerve endings that just feed that. But the fat cells dampen that, as you'll know, on a fattier area if you feel actually sensational wise, but they don't impact the nerve or the blood supply area in any way. The impact Maria.
Fat is very poorly perfused. There are hardly any major blood vessels within fat. That's why sometimes when you see someone who's cut themselves on a fatty bit, and you know, if you're a first aider or someone like us with nurses, you just see that fat's not got a lot of blood in it, not a lot of vessels.
No, but to answer the question directly, absolutely, Maria, to answer the question directly, it doesn't impact it at all. The only impact you'd find on the nerves is when you have inflammation in the area, you can get a bit of inflammation stimulating the nervous system, those little nerve endings, which is why some people would feel it more than others, or you get that numbness sensation where they're dampened. But to date, we have no clinical evidence of any nerve or vascular damage post-treatment.
How many years has it been going in total?
11. It'll be 11.
How many Coolsculpting? Do we know the numbers?
Last time I looked, it was over 8 million.
Yeah.
Internationally. Going down. Yes, I've just had confirmation that I am correct with my numbers. And I'm just going through to make sure I haven't missed any other questions. I haven't. So I think, well, again, thank you all for your time. I apologize again that you can see each other's names. I'll have to look into that. Going forward, I will be in contact with you. But if you have my contact details, don't hesitate to get in touch with me directly. I'm just going to turn off this video. Don't hesitate to get in contact with me directly, and we'll book a one-to-one consultation for you. Again, thank you so much for joining. Anybody who has any questions or wants to re-watch this, like I said, it will be running again tomorrow and on Saturday. Just the video will be running, nothing else in the background. Thank you so much for your time, and hopefully I'll see you virtually soon. Bye for now.